How often should mupirocin be applied for skin clearance?
Hello everyone. Today, we're going to discuss mupirocin, a medication commonly used for skin infections. In particular, we'll talk about the frequency of application for skin clearance.
What is mupirocin?
Mupirocin is a type of antibiotic that treats certain types of skin infections by stopping the growth of certain bacteria. It comes in ointment form and is usually applied topically, meaning directly on the skin.
How often should mupirocin be applied?
The general recommendation for mupirocin use is to apply it to the affected area 3 times a day. However, this could change based on the specific infection, its severity, and the individual's health condition. That's why it's critical to follow your healthcare provider's instructions for using mupirocin.
How should mupirocin be applied?
Before you apply mupirocin, wash and dry your hands thoroughly. Then, apply a small amount of the ointment to the affected area. Do not use a bandage, dressing, or wrap unless instructed by your healthcare provider. After applying, wash your hands again to avoid spreading the infection.
What precautions should be taken?
Mupirocin is for external use only. Be careful not to get it in your eyes, nose, mouth, or any other sensitive areas. If you accidentally get it in those places, rinse with plenty of water. Additionally, remember that antibiotic resistance can occur if mupirocin is used more often or for longer than prescribed. So, it's crucial to use this medication as directed by your healthcare provider. That sums up our discussion about mupirocin and its use for skin clearance. Remember, while the general recommendation is to apply mupirocin 3 times a day, your healthcare provider's instructions are the most important to follow. And don't forget to practice good hygiene before and after application. We hope this video has been helpful to you. Stay healthy.